In today's video, we are going to look at something interesting, a new concept. We are going to talk about relative risk and odds ratio. In subsequent series, we are going to take individual sections from the topics you need to know for the USMLE, and we are going to discuss them. We are going to solve a few questions. I have a number of questions we are going to look at together, and I will show you exactly how I approach these concepts and how you can approach them. To show exactly, just to demonstrate that they are very simple, basically, right? And you can learn them easily. You cannot discuss relative risk or odds ratio without talking about where they came from, where the idea of relative risk and odds ratio came from, and this would be observational studies. You would remember that relative risk was born out of cohort studies. And cohort studies was basically where you get two groups of people. A group of people that do similar things are described as a cohort. So if someone says you and your cohort, they mean you and your friends, you and a group of people that behave like you. So when we do cohort studies, we get two groups of people, say group A and group B. And we would say, for example, group A are smokers, group B are non-smokers. So group A will be one cohort, group B will be another cohort. And what we are going to basically be asking is, let's find out what is going to happen. Who will develop a disease? We start with people that don't have a disease, but are behaving in a certain way. One group is smoking, one group is not smoking. We follow you up. 10 years, 20 years from now, what will happen? Who will develop lung cancer? So we start from the risk factor, in this case, smoking, and we see who will develop the disease. This is known as prospective cohort study. There's a second type of cohort study, retrospective cohort study. Now, that is completely useless. Don't learn it. There's no point trying to learn. You're going to see one question or two, I think, in the Amboss Q-Bank. Not even on you, in the Amboss Q-Bank. But again, as I said, it's completely useless. Don't worry about retrospective cohort study. You should know prospective cohort study. You start from the risk factor, people that do a certain type of behavior, smoking or not smoking, and you follow them up into the future, follow them up for 5 years, and that's how your vignette would be. They'll tell you a group of people that eat this, or do this, and then 5 years down the line, they observed these patients and they found XYZ. That is what cohort study is. Now, if you're comparing two groups of people that do behave differently, this group smokes, this group does not smoke, what are you really looking for? Who will develop the disease? So what are you comparing here? Who has the greater risk? Is lung cancer likely in a smoker or more likely in a smoker than in a non-smoker? Does a smoker have a greater risk of developing lung cancer relative to a non-smoker? That is why when we do cohort studies, we calculate relative risk. We are comparing two groups relative to each other. Is a smoker at higher risk of developing lung cancer compared to a non-smoker, relative to a non-smoker? So when we do cohort studies, we calculate relative risk. And the formula is very simple. Now, you've learned a lot of formulas. There are this bunch of formulas in your first aid, A over B, B, C over C, D, or whatever. You're going to delete all those formulas from your memory. And I need you to remember just what I'm going to tell you. That relative risk is the risk in exposed over or versus the risk in the unexposed or non-exposed. I don't know which English is better. Relative risk is the risk in exposed versus the risk in unexposed. The risk in exposed over the risk in unexposed. Period. I need you to remember that. Another thing you want to remember is when you calculate, you're going to do each of them, right? You're going to say risk in exposed. So if the exposed group was, if we studied 1,000 smokers, for example, and we say 200 developed lung cancer, the risk in exposed will simply be 200 out of 1,000. Okay? The risk in the exposed will be the number of people that got it out of the total group. I know why I'm mentioning this. Just hold that thought in your mind. We'll come back to it in a bit. Then we talk about odds ratio. Odds ratio is born out of case control studies. Odds ratio is born out of case control studies. Now, when we talk about case control studies, a case in medicine is a sick person. So again, if we take group A and group B, a case in group A will be sick person, of course, and group B is the control, a person that does not have the disease of interest. Okay, that is case control studies. Now, we are starting from the sick person. If I'm comparing a sick person to a healthy person or a person without the disease, we are starting from the disease and we are going to be asking which of them was exposed to the risk factor. I get someone that has lung cancer already, and I get someone that does not have lung cancer already. My question is going to be, well, you have lung cancer. Were you a smoker? Do you smoke? You don't have lung cancer. Did you ever smoke? And what we want to find is what are the odds that a patient with lung cancer smoked? That's the English there, right? What are the odds that a person with lung cancer was a smoker? Compare that to relative risk, where we said, what is the risk of a person getting lung cancer if they smoke today? So what is the risk of developing lung cancer if you smoke now? If you're a smoker now, what's the risk of developing lung cancer? If you have lung cancer now, what are the odds that you smoked? So odds is going backward, risk is going forward. Don't confuse yourself with all that. Now, knowing this, what do you need to calculate if you're doing the odds ratio? A ratio of odds. The odds in the exposed over the odds or versus the odds in the non-exposed. Okay, so when we do cohort studies, we calculate relative risk, the risk in exposed over the risk in unexposed. If we are doing case control studies, we calculate the odds ratio, the odds in exposed versus the odds in the non-exposed. But that is the same thing, exactly the same thing, which is why it's very simple. So please remember them exactly as I have shown you. The difference, though, is that when you calculate odds ratio, if I ask you to find the odds in exposed, remember I told you risk in exposed, we took 1,000 people that were smokers, and we said 200 of them had lung cancer. So the risk in exposed would be 200 out of 1,000, right? 200 out of 1,000 developed lung cancer. In odds ratio, though, if I tell you that 1,000 people we are smokers. No, here we are going to start with these sick people. So let's say 1,000 people have lung cancer. Of this 1,000, 800 smoked. 800 were smokers. The risk in exposed, or the odds rather, you see, even myself, I use the language carelessly. The odds in the exposed will be 800, not over 1,000, but over the difference, over 200. So of the 1,000 people with lung cancer, 800 smoked, 200 did not smoke. So we go 800 over 200. Whereas when we did risk or relative risk, the risk in exposed was 200 with the disease over the total. But in odds ratio, we are not doing over the total. We just go 800 over 200. We will talk about this a little more when we begin doing the calculations, and I think it will become clearer. Again, remember the formula. The relative risk is risk in exposed over risk in unexposed. You should say it out loud so it sticks. The odds ratio is the odds in exposed over the odds in the non-exposed. You don't need to memorize any much longer formulas. Let's look at the first question. You can pause the video and attempt to get this question yourself, but I'll jump right in. The prevalence of breast cancer is compared in two groups of women based on parity. The following data are obtained at age 70 in both groups. Based on this data, what is the relative risk for development of breast cancer in childless women compared with women who have children? Childless women compared versus women with children. Childless women versus women with children. So how would you calculate the relative risk? Risk in exposed over risk in non-exposed. In this case, the risk in exposed will be the exposed group will be the childless women. The question said the relative risk in childless women compared with women without children. So the first one is going to be the numerator and the second one will be the denominator. You should always remember that dynamic. So the relative risk here is risk in, let's just write childless women over the risk in women with children. Okay, then we go to the table right here and we look at the risk in childless women. Where are the childless women? This group here. Of the childless women, 180 developed breast cancer, and the total was 1,000. We said when you calculate relative risk, you use the total. So the risk in childless women will be 180 over 1,000 versus or over the risk in women with children. 120 women had breast cancer that had children, and of course 1380 did not. The total was 1,500. So we are going to go 120 over 1,500, and this is basically what we need to calculate. If you want to break this down, or if you want to use a calculator, you can use a calculator. I prefer to simplify it. You can do 180 over 1,000 divided by 120 over 1,500. In mathematics, when you change the division to multiplication, you switch the numerator and the denominator. So this becomes times 1,500 over 120. 0, 0, 0, 0, 0, 0. We have 18 times 15 over 12. I think if you do that math, it should give you 2.25. I hope my thinking brain is still working. I hope you got that question right. All right, next question. This is a question on odds ratio, right? A case control study is conducted. So first of all, it's a case control study. So you know they're going to be asking you to calculate the odds ratio. You can read the whole vignette, or you can almost at this point just go to the question because you know what it's going to be. But let's just read it. To determine if women who delay childbearing are at increased risk for having children with low birth weight, a group of women who were at least 35 years old during their first pregnancy are compared with a group of women who were between the ages of 20 and 24 years during their first pregnancy. The following data are obtained. What is the odds ratio for an older woman relative to that of a younger woman? Now, don't make the mistake of thinking that they're asking for relative ratio. The question said, what is the odds ratio for an older woman relative to that of a younger woman? That confused one of my students sometimes. It's not relative risk, it is still odds ratio to have an infant with low birth weight. Now, we said the odds ratio is the odds in the exposed over the odds in the unexposed. In the question, they said the odds for an older woman relative to a younger woman. So the older woman is the numerator and the younger woman is the denominator. So odds in older woman over the odds in younger woman. Who is the younger woman? 20 to 24. Older woman is greater than 34 years old. So when we do these maths, you have to find the odds in older women. The odds is going to be, of all the old women, 54 had low birth weight babies. 745 did not have low birth weight babies. So you go 54 over 745. That is the odds in older women. Now, remember, when we did relative risk, we used the total. We did 54 over 799, for example. When we do odds ratio, I told you don't do the total. You say the number that have whatever it is you're interested in versus whatever is left. So you're finding the difference. So 54 low birth weight, 745 normal, 54 over 745. That difference is very important. And then for the young women, we are going to have 21 over 404, right? That is it. In this case, they don't really want us to calculate or do anything interesting, so we just go and look for our answer. 54 over 745 over 21 over 404, and option C is going to be correct. Pretty simple, right? I hope you agree with me. Then we have this question: if one person in 10,000 with a negative PPD skin test has active TB, 1 in 10,000 have active TB, and 1 person in 100 with a positive PPD skin test has active TB, which of the following is the estimated relative risk of active TB in persons with a positive PPD skin test? Again, they're asking you to calculate relative risk. People with negative 1 in 10,000 with negative PPD skin test has active TB, and 1 in 100 with positive PPD skin test have TB. Which of the following is the estimated relative risk of active TB in persons with a positive PPD skin test? This question might seem slightly challenging for a number of you, but I hope you paused the video and tried to solve it yourself. What is the relative risk of active TB in persons with positive PPD skin test? So you're going to have the risk in people with positive PPD versus the risk in persons with negative PPD. The risk in positive PPD, they already told us, is 1 in 100, 1 over 100, divided by the risk in negative PPD is 1 in 10,000. I hope this makes sense. 1 over the total. They said of all the people with negative PPD, 1 person had TB. So 1 in 10,000. Of all the people with positive PPD, 1 person in 100 had TB. So we came up with this equation. When you expand this, you're going to have 1 in 100 times, we do the same thing we did in mathematics, 10,000 over 1. 0, 0, 0, 0, we are left with what? 100. Pretty straightforward, pretty simple. If you have any questions about any of these things, leave them in the comments, send me a message. I would figure out a way to help you with that, okay? And finally, we have this last question. You can try this question. Look at it. It's a question on odds ratio. I would like you to solve this question actually by yourself. If you get the answer, put it in the comments. If you get it right, I will give you a response and let you know you got it right. If you get it wrong, I will also give you a response and let you know you got it wrong, hopefully with some explanation that would make sense as well. Until next time, again, keep your heads up, leave your questions in the comments, and I'll see you guys on the next one.